With that then, I'm going to turn it over to Neal Lyons, who's going to have a whole presentation then on debunking and kind of going systematically at some of the claims being made by public health entities like the CDC and others. That'll be part of his presentation, and then also looking more and following up more on some of the themes that Shanta was already addressing. So Neal, I'm going to turn it over to you if you're able, if this is a good time.
Okay, I'm going to try and share the screen. Is this showing for people?
Yeah, that's showing.
Yeah.
And let's see, full screen. Okay, well, it really isn't an accident that we as a civil rights organization and immigrant rights organization are in the position we are of leading a fight around really public health and safety in this pandemic. Martin Luther King was, regularly criticized when he started his campaign against the Vietnam War, asked the question, what's a civil rights leader got to do with the war? Well, not just in the fact that this pandemic disproportionately is affecting the majority Black and brown urban centers of the country, that by itself makes this a critical issue for us, but also because the methods of struggle that are going to be required are things that only an organization committed to the methods of a mass movement can really address. Right now, parents are facing the threat of losing pandemic unemployment assistance. Teachers are under the gun to return to their school buildings, and all sorts of economic pressures are being put on people. And so far in the pandemic, people's main methods of dealing with these pressures have been individual. Just parents trying to make an individual decision on how to keep their kids safe, teachers figuring out how they can avoid being inside a classroom, and this has largely gone on without any kind of truly organized support, but simply by the individual actions of millions of people. It has so far been able to keep school openings to a minimum, far below the what the Trump administration had attempted, and below what the Biden administration is attempting now. It's our task at this moment in history to bring the methods of a movement to those struggles, to unite the millions of parents and teachers who have been acting independently simply on their own good sense, and to combine those actions into a force that is capable of overcoming all of the economic pressures that are being put on people right now. And it is an economic question. No one thinks, no honest person thinks that there is truly a safe way of reopening schools in this environment. This is about the real economic stimulus policy that is going on. Now, Congress may have just passed a $1.9 trillion stimulus package, but in reality, that seemingly large number is tiny compared to what the school closures cost the economy. Last fall, the think tank, the Organization for Economic Cooperation and Development, estimated that the cost of the school closures would be around $15 trillion. that is much, much bigger than anything that Congress can pass. So the one thing where the business world is united and the Democrats and Republicans in reality are united is in passing their real economic stimulus measure, which is forcing the schools open, forcing parents to send back their kids, forcing teachers back in the classrooms. This is very much the expression of the same kind of thinking that people like Representative Hollingsworth and Texas Lieutenant Governor Dan Patrick were saying, which is that death from coronavirus is the lesser of two evils compared to economic downturn. And Patrick was saying that old people are perfectly willing to die if that means saving the economy. That is what the school reopening plan is. In a nutshell, it is a preparedness to sacrifice human life for the sake of corporate profits. And that is not hyperbole. In the larger picture, simply the degree to which the United States has been out of control in terms of its level of disease spread, compared to China, this has caused an enormous setback in the United States. China has been one of the countries that did a relatively decent job of containing the pandemic. And with the countries that have done well, China, South Korea, New Zealand, Australia, the way that they've done it is completely unlike anything we see in the United States. They literally do try to track down every person who may have been exposed, test every person who may have been exposed. They interview everyone. They go to every single location that those people went to, and they find every other person who was in those locations. It is a thoroughgoing contact tracing, person by person, test by test, and that's how they have managed the crisis. And everyone on this call knows we are not living in a country that has done anything like that. The result of that failure by the United States in pandemic control is that China is poised to become the world's most dominant economic power far ahead of schedule. It had been estimated that the timetable for Chinese dominance would probably occur in 2033, and now it's estimated 2028, a 5-year change in the projection for China's dominance. This is a very big economic question for the United States, and this is the real context of the policies that we're seeing in relation to the schools. On the health side of this, the first element that makes this situation much more dynamic and much different than we faced before is that the coronaviruses of 2021 are not the same as the coronaviruses of 2020. The Wuhan strain of SARS-CoV-2 is truly old news. New variants have taken the place of the Wuhan strain. In the United States right now, the variant that was first identified in Britain, known as the UK variant, is now the dominant variant in the United States. And there are a couple of other variants, the Brazil variant and South Africa variant, which are especially important to note, and I'll get more into that. The thing that all of these variants have in common that have now all but completely replaced the original strain is that they are all more infectious. There's a simple scientific reason for that. And in reality, any of the scientists dealing with this question understood that that was going to be the case. They understand that the virus is more infectious now than it was previously. And they knew that it would be true, and they were not warning people about it. The science is relatively straightforward when it comes to evolution, and okay, all of the nuts and bolts of evolution can be very complicated, but the bottom line is that evolution is just about reproduction. Evolution is the story of what reproduces and what doesn't, what is better at reproducing, and that is responsible for changes that occur over time. The process for the evolution of a virus is especially straightforward. Wherever there is transmission, the virus is replicating itself. And replication creates a lot of opportunities for something to go wrong, for there to be some kind of damage or something in the RNA to be copied improperly. That leads to mutations, many, many millions of differences in the way the virus is being copied. Most of those differences don't really go anywhere. They're simply random damage, and you know, just like damaging a part of your computer or your car, it may not work as well. But occasionally, some of those mutations work better than the original. And when they do, and they in fact are better at reproducing, better at spreading, those are what we know as variants. And when a particular variant becomes so dominant that it is replacing the original strain, it becomes what we consider a new strain, and that is the process of evolution. The only way to slow down that process of evolution is to go right back to the top of the process to slow down the transmission. The danger is that with the reopening of the economy, it speeds up the evolution of the virus. It speeds up the development of new variants and strains in a way that makes it hard for the vaccine production to keep up. Not only in the number of vaccines that are being given out, and that process takes some time, but also some of these variants and strains become vaccine resistant. And the more variants and strains that you have, the more likelihood that you will have certain ones that vaccines just don't work very well against. And for that reason, I want to draw people's attention in particular to what's being called the Brazil variant, or P1, which is more than 50% or maybe double as infectious as what it came from. The Brazil variant is overwhelming hospitals in Brazil, and it is sending much younger people to the ICUs than was previously the case. It's been normal for, you know, somewhere around 80 or 90% of the ICU patients for COVID to be senior citizens. Now with the Brazil variant, they're seeing people in their 20s, 30s, and 40s in the ICUs in significant numbers. The other important thing about the Brazil variant is that it is vaccine resistant, whereas the vaccines are normally around over 90% effective against the original Wuhan strain and against the UK variant, which is dominant now. The vaccines are only maybe 50 to 60% effective at preventing infection from the Brazil variant. And this is a very bad combination of qualities. 3 different qualities: 1, more infectious; 2, better at infecting younger people; and 3, vaccine resistant. And given how out of control Brazil is, this variant inevitably moves into Central America. And in the Central American countries, many of the poorer countries are not scheduled to receive even a single dose of vaccinations until the year 2024. This adds to the immigration crisis. And there are going to be tens of thousands more people just desperately seeking refuge. And this threatens to turn the immigrant concentration camps, which have, survived the Trump regime and are continuing in the present one. This can turn those concentration camps into death camps. And the United States is nowhere near equipped to handle the contact tracing for rooting out this variant or any other variant. While I do not know just how infectious this variant is compared to the UK variant, which is presently dominant here, simply the fact that it is more resistant to the vaccine means that this and whatever develops out of the Brazil variant are going to be very relevant for the near future. This also just compounds the crisis of the fact that vaccine production itself is kind of slow. There were many calls for Biden to use the Defense Production Act for producing more copies of the vaccines. And turns out that wasn't necessarily going to be all that helpful, because it isn't all that easy just to create whole new laboratories and fill them with a bunch more scientists. Pfizer has been trying to work out deals with its competitors to help produce their vaccinations. And also the vaccines for children are slow going, just because it takes a while to test what is the correct dose of the vaccine to be giving out. If the dose is too small, there won't be much protective effect. If the dose is too large, you can overinflame a person's immune system. And so they test on children very gradually, and it takes months. No vaccines for younger children are expected to be available until the fall at the earliest, and their availability will be limited. There's potential for teenagers to have access to vaccines by the summer, again with limited availability, at least for the Pfizer vaccine. But again, the rollout of children's vaccines is slow, and the danger of reopening now and the danger of accelerating the development of variants is precisely that you outrun the vaccines, and it creates a situation in which the vaccines can be made almost obsolete. Thankfully, even for the more vaccine-resistant strains like the Brazil and the South Africa variant, at least the vaccines are pretty good at making sure people don't get severely ill and hospitalized. But the rate of infection is alarming, and it shows us this virus is evolving quickly, and the political systems that we have in the United States are not up to the task of making sure that the science can keep up and that the vaccines can keep up. It is essential to be keeping schools closed in order to make the situation remotely manageable. And yet, here you have a map of um, of school districts and their reopening plans. The lighter the shade of purple, the more it is focused on virtual learning, and the darker the shade, the more it is in person. And this is without any vaccinations available for any students. It is the most backwards aspect of public health policy to be forcing the unprotected section of the population that has no access to vaccines into a situation in which they can be exposed to the virus. If anything, the fact that the children's vaccines will be the last to arrive should mean that schools should be the last to reopen. But in an open school environment, whatever variants of the virus are best at spreading among children are certain to become dominant, and it enables a course of evolution for the virus to be promoted that is directing the evolution to be better at infecting children. So what we have with all of these reopenings is a concerted campaign, but it's one that looks very different than the campaign of school reopenings under the Trump regime. Trump was just an obvious and blatant liar. And nearly everything he said was self-evidently false. He wanted to call the pandemic a hoax. He wanted to suggest that people should inject themselves with bleach to combat the hoax non-existent virus. And he wanted to claim that children are immune. All of these things that were obviously and truly false, but the problem for so many people now is that the lies that we're hearing now are much more sophisticated. The lies we're hearing now use plenty of scientific studies to back them up, use plenty of facts, and that's a different kind of lie, a lie that it's a kind of lie that we have all told. When someone accuses you, you ate my cheesecake, you can reply, I haven't eaten anything at all today. And that can be true because you ate the cheesecake last night. That's in a nutshell the kind of lying that we're hearing from the CDC, but it all involves scientific studies which are technically factual. And so a lot of the point of what I'm trying to do in this presentation is help people sort out myth from fact and understand how those lies work. One of the consistent lies we're all familiar with is the idea of herd immunity. Under the Trump administration, herd immunity was touted as a strategy. We want them infected, were the words of one Trump staffer, who was even a science advisor. Herd immunity itself is an actual scientific concept. It's a real thing. Once you have enough people vaccinated, the rate of transmission of a virus can drop down to 0. So if you have 60%, 70, 80% of a society immune, a virus will stop spreading. Now, there was nothing scientific at all about the Trump policy of herd immunity. In fact, people getting infected did not guarantee that they would be immune to being reinfected, even just a few months or even a few weeks later. And especially with the new variants, people who recovered from the original Wuhan strain have been able to very easily get infected with the new UK variant or the Brazil variant. And that has been happening all over. The way that this lie has changed Um, no longer is there a an open policy of we want them infected, but people like Anthony Fauci are still promising that at some point we will reach herd immunity. But as it turns out, many top scientists around the world are now saying that looks impossible, that the course of the coronavirus looks very similar to the way that the flu developed. And there's no such thing as herd immunity against the flu, no matter how many people get vaccinated against the flu. It spreads too quickly, it evolves too quickly. And then this just raises the question, why are we still getting the promise of herd immunity when the science seems to be showing that exactly the opposite is the case? This is a false promise. The reality is we are getting the promise that everything is going back to normal because the policy is to tell people to start going back to normal in their day-to-day work life and school life, and in fact normalize living with death, living with a pandemic. That is the real policy. None of these scientists who are promising herd immunity, I don't think they actually believe that is arriving. They're very much aware of the scientific studies that that suggest that the coronavirus is here to stay for a long time, but they are promising a return to normalcy because they want you and me to go back to normal. They want you and me to go back to work, to go back to school. And just to make living with people dying an ordinary part of life. We have heard that the numbers are plummeting and the cases are going away, and that is one of the big optimistic things that Fauci gets on TV to say very often. Well, the numbers did plummet. If you look at the chart in the upper left, flu season was terrible for COVID-19. The cases around, in particular, the holidays, you see the Thanksgiving spike and the Christmas spike are real drivers of the pandemic, and then things slid back down over the month of January and some into February. But the numbers are not plummeting now. They have plateaued and they're poised to go back up. And if you look at where the numbers are now, as of this chart, which extends until March 11th, 2 days ago, the numbers of new cases now are higher than they were when schools tried to reopen last fall. So if it was unsafe to reopen schools last fall, it is certainly unsafe to open them now with a higher caseload and with the completely different variant of the virus being dominant across the country. And in fact, when you look in the upper right-hand corner for the worldwide cases are on the rise again. The United States is going to reflect that. The US is responsible for more than a quarter of the cases in the world as a whole. And this is just out of control. Now, with the CDC, it is very difficult for someone who doesn't follow the science to keep up with what are the reports really saying. And the CDC, in particular, the new head of the CDC, Walensky, they are very good at bringing up lots of studies to suggest something that those studies don't actually prove. Now, it is technically true, for example, that children and adolescents are somewhat less commonly infected than adults. But that technically factual statement is being used to tell a lie. It's being used to say, don't worry, the kids are safe. You can go back to school. But children can be infected. Children can transmit the virus. Children can become sick from COVID-19. Children can die. This is, and in fact, the entire method of the CDC report is picking and choosing between different scientific studies to try to make a case that isn't really true. And we'll see more of this. Another technical fact, based on the data available, in-person learning in schools has not been associated with substantial community transmission. Although national COVID-19 case incidence rates among children and adolescents have risen over time, this trend parallels trends observed among adults. Okay, so there's no big difference between school transmission and community transmission. Of course, it would be similar, but that's being used to tell the falsehood that schools make no difference at all to the spread of the pandemic. And that is a big lie, and we'll see why in a moment. But every teacher and every parent know that schools can and do spread disease, and they're very good at spreading disease. They're wonderful petri dishes for spreading disease. That's not the issue. The real issue is the actual safety of students and teachers. And without any vaccines available for young people at all, the level of safety in a school is even worse than the level of safety in a workplace. It's technically true that transmission in school settings is usually a bit lower than or similar to levels of community transmission, which goes along with the fact that young people have been slightly less likely to be infected. That's to be expected. But the lie that's being told here is schools are therefore the safest place in the community. Community transmission is out of control in the United States in particular, and school transmission will reflect that fact. Now, this is one of those picking and choosing your scientific studies very deliberately examples. The CDC uses examples from many rural districts and many places during a time when there were low levels of infection. In Michigan and Washington, delivery of in-person instruction was not associated with increased spread of COVID-19 in schools when community transmission was low, key words. But cases in schools did increase at moderate to high levels of community transmission. When community transmission was low, there was no association between in-person learning and community spread. Boy, are those important words. The lie that's being told is in-person education doesn't spread COVID-19. But the fact that everything here relies on that qualifier when community transmission was low means it does not apply to anywhere in the United States, to anywhere that we work or go to school. And the studies that are used by the CDC, not only from rural Michigan or Washington or Wisconsin, the CDC also uses studies from Australia, which has had some of the lowest levels of transmission anywhere in the world. That's a completely different circumstance than the United States. It's really irresponsible to be comparing the two. But of course, the CDC is careful, and they can make sure that you can fact check them And they used that qualifier when community transmission was low. Again, kind of emphasizing the rosier side of stuff, evidence suggests that staff-to-staff transmission is more common than transmission from students to staff, staff to student, or student to student. Well, they're trying to make the point students aren't a significant factor in transmission. Therefore, there's no need to wait for vaccines. No need to wait for kids to get vaccinated. They aren't really spreading this stuff around. In fact, the word vaccine does not appear at all in the CDC report. Vaccines have been used for decades. They have been used since long before I was born. They are a standard safety precaution in schools. In particular, many school districts around the country, I think most school districts, require that children are vaccinated to the measles in order to attend school at all. And the measles, and yes, it's great that people are vaccinated to that, but measles are not as deadly as COVID. And so if you have to be vaccinated for the measles, it would only make sense that you're vaccinated for something more deadly. It makes sense that you're vaccinated for COVID as well. The CDC report cannot even use the word vaccine anywhere. You can do a word search because it's the most obvious safety measure that that has to be ignored if you're reopening schools right now. And in fact, they want to suggest that the exact same mitigation strategies which were used under the Trump presidency will suffice for now. No need for vaccinations, masks are fine. Yes, we agree, masks are essential. In particular, the N95 mask has been one of the most essential tools to make sure hospital workers are even able to cope with the pandemic and cope with COVID patients. Those N95 masks should be available for everybody because of how useful they are, but vaccines are essential too. And masks and vaccines don't work in the same way, and their percent effectiveness is a different kind of percentage and a different kind of effectiveness. But even then, the CDC guidelines are only recommendations. None of this is enforcement. And in reality, none of the things that the CDC is doing are things that actively make anyone safe. These guidelines, which are just suggestions, like most of the things that the CDC does, whenever they make guidelines, they function more as liability protection for corporations and schools to say, and what I mean by that is if someone would decide to file a lawsuit against a business or a school because of some injury or sickness that they got, the liability protection comes in by the business or school being able to say, well, we followed the CDC guidelines. So that means we did everything right on our end, so you can't sue us. And that is really the only role that these CDC guidelines are playing, because nothing about them is actually enforced. They are there more to protect the legal liability of schools and businesses that are reopening than they are to protect the general population against the virus. Okay, so let's get to the truth. I have 3 studies. Last time I just went through 2. None of these 3 studies, and they're massive, ended up anywhere in the CDC reports, and you will see why. This study was published in the Journal of the American Medical Association, called Association Between Statewide School Closure and COVID-19 Incidence and Mortality in the US. The basic finding of the study was that the effectiveness of closing down schools was massive at reducing the spread of disease. This study occurred between March and May of 2020, and school closure resulted in a 62% drop in the incidence of COVID-19 and a 58% drop in the incidence of mortality from COVID-19. That's enormous. That should give you a sense of just how big a deal it is, having schools open versus schools closed. Use this fact to put everything else you're hearing from the CDC in context. And this is just not just some anomaly, and the Journal of the American Medical Association is not some rag of conspiracy theorists. This next study comes from the science journal Nature. It's a study of over 200 countries called Ranking the Effectiveness of Worldwide COVID-19 Government Interventions. These are governmental measures that are beyond normal public health precautions like masks and things like that. These are things like governments doing airport regulations or canceling small gatherings or closing schools. And in this study of over 200 different countries, they found that school closures were the second most effective measure internationally out of government interventions for slowing the spread of disease. The symbol delta RT, that just means change in the rate of transmission. Delta refers to difference or change. R is rate, T is transmission. And so that's what this study is tracking. It's tracking delta RT for all of these different measures. The least effective measure in the world for government interventions was calling for international help or receiving international help. Doesn't do much, but closing down schools is very effective at reducing the rate of transmission. 73% effect on the rate of transmission. And lastly, another multi-nation study, 130 nations, this published in the BMC Medical Journal. Again, finding that the strongest measures for reducing the transmission of the virus, these are non-pharmaceutical interventions, were school closures and internal movement restrictions. For the people who are trying to keep their schools closed, we have science on our side. These studies, in particular, these last two studies that I pointed out, are massive, encompassing many different countries. And of course, the American Medical Association study shows the effect of school closures in the United States in particular. And what this should also tell you is just how dangerous it can be to reopen schools at a point in which the new cases per day are higher now than they were when schools reopened last fall, in a situation in which now the virus itself is a different virus. In the United States, the UK variant is dominant. And I encourage people to keep an eye out for the Brazil strain. It is a shame that there isn't more robust testing in the United States to find out which variants are spreading where. But that is a serious problem. And we are in a situation now of trying to build the kind of social struggles that we need to build to keep ourselves and each other safe. And just going back to where I started, we are a civil rights and immigrant rights organization, and we need to bring the methods of a new civil rights movement to this situation to introduce those tactics of social struggle into the realm of keeping people safe, as that is the one best way that we have of combating the enormous economic push that we are facing. So I'll just end there. I apologize for how long that took. But I hand things back to you, Yvette, and we can move on to what's been working and in the work that we've been doing.
Great. Thank you very much, Neal. That was